5 things you need to know before you have breast augmentation. 1. There are 2 types of breast implant. One is saline, which is salt water. 2 is gel, which is a jelly-like substance put into a bag. 2. The pros and cons of these 2 type implants. First, the pros of saline. It is lifelong. It is safer. There's no controversy about it. It has been put in for 30 years or longer. You don't ever have to take it out even if it deflates, which is the major complication. You could leave it in and do it at your leisure. It is a small scar, at least in my hands. The disadvantage of saline is that if you don't do it properly, one can feel a firm water bag inferiorly at the bottom of the breast when it's not put in properly. The advantages of gel is that if it's put in above the muscle, it does feel more breast-like. The disadvantages of gel are that it's much more expensive, especially initially. It's 2 to 3 times more expensive, and you have to do, by the FDA's recommendations, X-ray test every 3 years, MRI, and you shouldn't leave it in more than 7 to 10 years, so you have to change it out every 7 to 10 years. 3. Implant enough. Is the implant by itself enough for most breasts to enlarge them? Breast implants will almost always make a breast better, but it may not be enough, especially if they're contour and shape abnormalities. And you may need something else in addition, another surgery like a breast lift. 4. Recovery time. Usually about a week. With sports is what I recommend, 2 to 3 weeks. But if you go very, very big, it may be a little longer. 5. Choosing a surgeon. I have a trick here. Ask your surgeon if he can perform the breast augmentation in the hospital. If he says yes, then you're cleared. He's probably qualified, because most hospitals will verify qualifications and see if they appropriately qualified by the appropriate board before they perform the surgery. However, in an office setting, you do not have to be board certified to do any procedure. So if a doctor is not qualified, he may want to do it in his office and not at all in the hospital. These are the 5 things you need to know before you have breast augmentation.